intraosseous infusion. For this skill, you will need the following equipment: IV fluid, IV tubing, 10 milliliter syringe, an IO needle, antiseptic, gloves, 4x4 dressings, and tape. Wear gloves and any other appropriate PPE as needed based on local protocols and the patient's situation. Initiate any appropriate BLS and ALS procedures. Decide if vascular access is needed, and if no peripheral site is accessible, the need for IO access. This will almost always be in an unconscious, critically ill patient. Prepare your equipment. Check to be sure the fluid is clear and has not expired. Clamp the tubing and attach the infusion set to the bag. Squeeze the reservoir until it fills halfway. Then open the clamp and flush the air from the tubing. Close the clamp. Withdraw 10 milliliters of IV fluid into a 10 milliliter syringe. Select the desired size of bone marrow needle. Prepare your antiseptic wipes, dressing, and tape. Select the appropriate site. The preferred site for IO infusion is the tibia, 1 to 2 finger breadths below the tubercle on the anteromedial surface. Other possible sites include the femur, 2 to 3 finger breadths above the lateral condyles on the middle, or on the tibia just proximal to the medial malleolus. Cleanse the site. Begin in the center and work outward in a circular motion. Use the antiseptic indicated by local protocol. Adjust the needle to the appropriate depth. Stabilize the leg. Insert the needle aiming away from the epiphyseal plate. Using a boring or screwing motion, advance the needle until a slight pop is noted. Then remove the stylet. Attach the syringe and aspirate. Marrow may or may not be observed. Push the plunger and inject the saline from the syringe. It should inject smoothly and without excessive force. Attach the IV tubing and adjust the flow of the IV fluid by opening the tubing clamp. Observe the site to ensure there is no swelling. Administer at the prescribed flow rate. Continue to monitor the patient and the site.